There are 10 steps to Rejenevie's immune restoration program. Steps 1 through 5 all occur in the United States. Step 1. The patient visits their doctor where they are screened and cleared to receive the stem cell mobilizing drug. They also have their baseline blood testing performed. Step 2. The patient will visit one of our nationwide collection centers where you will receive a daily injection of a stem cell mobilizing agent over the course of 5 days. So this will require 5 separate visits to the collection center. Step 3. On the 6th day, the patient returns to the cell collection facility to undergo a process of leukapheresis. The entire process takes about 4 to 6 hours and yields a highly concentrated mixture of the stem and immune cells that are in your peripheral blood. Step 4. The blood bag is transported to our U.S. facility for processing and cryogenic storage, short-term for 72 hours. During that time, the cells will undergo quality control testing. Step 5. Once the cells have passed the quality control testing, they are transported to Indianapolis, where they are stored long-term in our biorepository. Steps 6 through 9 occur at the Okyanos Center for Regenerative Medicine in Freeport, Bahamas. Step 6. When the patient is ready to schedule their treatment at Okyanos, both the patient and donor cells are transported from Indianapolis to Okyanos for the 7-day clinical manufacturing process. Step 7. After 7 days, the donor cells are removed from the transwell and the patient's cells are centrifuged. Step 8. The patient's cells are extensively washed to remove any residual donor factors. Step 9. The patient arrives at the Okyanos clinic and is able to be infused with their own stored immune cells over the course of 1 hour via IV infusion. 30 minutes after the completion of their infusion, they are discharged and able to return home. Step 10. The patient will undergo periodic blood testing using a kit that we've developed to assess the safety and efficacy of their treatment. There are 3 options for the blood collection. First, the patient can utilize their own home nurse or home doctor for the collection. The second option is to utilize XAM1 mobile service, which will do the collection at your home. The final option is to utilize one of our nationwide patient service centers.